So, assalamu alaikum to everybody. Good morning, good afternoon, good evening, wherever you are joining us from different parts of the world. My name is Dr. Sohaila Chima. I am the Assistant Dean for the Institute for Population Health here at Weill Cornell Medicine in Qatar, and also an Associate Professor of Clinical Population Health Sciences. I would like to extend a very warm welcome to each of you for today's session. We have a great speaker for today lined up, and I'm going to introduce him just in a couple of minutes, but just let's go through some housekeeping before we start the session. So just as a reminder, the objectives of the series are to discuss contemporary and critical topics which are relevant to healthcare, medicine, population health. We look at evidence, examine evidence-based practices which are germane to public health and patient care. And then we also describe opportunities and challenges in the evolving face of healthcare and population health. So some housekeeping: your cameras and microphones have been turned off. You can use the Q&A feature, the tab, to type questions or comments. You can also post your questions and comments in the chat. So we will be able to view them. So if you don't want to post them in the Q&A tab, please go ahead and post them in the chat. And questions will be addressed at the end of the session, and I'll be moderating the session today. Of course, this is an accredited activity, and it's accredited by both ACCME and by DHP, at the Ministry of Public Health, Department of Healthcare Professions Accreditation section. So you will be able to claim credit commensurate with the extent of your participation in this activity. We wanted to highlight a very important note today, and you all as healthcare practitioners in Qatar might be aware of this. Healthcare practitioners who are licensed in Qatar, there was a circular number DHP 2023/110 dated December the 19th, 2023, from the accreditation section, Department of Healthcare Professions, DHPAS, Ministry of Public Health, on recording attendance of DHP accredited CPD activities conducted in the state of Qatar in the e-portfolio accounts of healthcare practitioners. You are required to provide your Qatari ID number, which is the QID, and the MOPH license number to your CPD provider. Again, in this case here for today's session, we are the CPD provider. So you will have to provide us with your Qatari ID number and your MOPH license number. Kindly ensure that your QID, the Qatari ID number, and your MOPH license number, they match the registration and licensure details in the MOPH's database. This will allow us to record your attendance accurately, as this is now required by the Department of Healthcare Professions. After we are done with this session, you will receive an email notification with a survey link where you can fill and submit this information. Please ensure that the email ID associated with your Cloud CME account is entered in this survey as well. So this is very important because this is something new which DHP has started. So it's very important for you to follow through so you can get the credits for this session. So again, as per normal, after this session, post-activity evaluation will be available in your Cloud CME account by Jan 27th. Healthcare practitioners who are licensed in Qatar will only receive their credits once the Qatar ID and MOPH license number is provided. So you will receive an email notification once the evaluation is available in your Cloud CME account, and your certificates will be available for download once you complete the post-activity evaluation on the Cloud CME portal. So that's some important information that we had to share with you. And then now moving on to today's session. So we have a very, very exciting talk today. It's titled Lifestyle Medicine, a Breath of Fresh Air in Healthcare. It is indeed my honor and pleasure to introduce the speaker for today, Dr. Ravinder Mamtani. He is Professor of Population Health Sciences, Professor of Medicine, Center for Global Health, and Vice Dean for Population Health and Lifestyle Medicine at Weill Cornell Medicine in Qatar. He is also a Professor of Community and Family Medicine, adjunct at New York Medical College, Valhalla, New York. Prior to joining WCMQ, Dr. Mamtani was a Professor of Clinical Community and Preventive Medicine and Associate Professor of Clinical Medicine at New York Medical College, and a physician in occupational medicine and complementary medicine at Westchester Medical Center in Valhalla, New York. He has several years of clinical experience utilizing integrative and lifestyle medicine to treat chronic diseases such as chronic pain, arthritis, mental health conditions, gastrointestinal problems, obesity, dyslipidemia, and diabetes. He has published in peer-reviewed journals and written a monthly column for local newspaper in New York on contemporary health issues. Dr. Mamtani serves or has served on many government, hospital, and medical school committees in the United States and Qatar. He is a diplomat of the American Board of Preventive Medicine in the specialties of preventive medicine and occupational medicine, and is US board certified in lifestyle medicine and integrative medicine. Please join me in welcoming Dr. Mamtani for the session today. Dr. Mamtani, a very warm welcome to you. Over to you.
Thank you, Dr. Chima. Let me see if I can share my slides. Can you see them?
Yes, we are able to
great.
see them.
So let's see. So first of all, Dr. Chima, thank you so much for that very generous introduction. I'm grateful to you and to your team. So this is what I propose to do this afternoon. Talk about lifestyle medicine, a specialty or an area of interest that is growing by leaps and bounds worldwide. And so let's see if I can move this. I have no disclosures to make. I'm not going to be discussing any products or any services that entail any disclosures. So I will do three things. One is I'll talk about the current healthcare paradigm. I think it's important to put things in perspective. And then I will jump into discussing the evidence for lifestyle medicine in the management of chronic diseases. And again, because of time constraints, I can only go so far. So probably give you some information on how strong the evidence is to support the use of lifestyle medicine. And then finally, for the last few minutes, I'll discuss a strategy that we may have in place for institutions that could successfully integrate lifestyle medicine in our healthcare systems. So this is to put things in context. The world has done well. As you can see that our life expectancy has gone up. You will also notice that right here in the last 2 or 3 years, there's a slight dip. And I'll talk about that dip in a few minutes. But for now, COVID-19 can explain that. But also there are a lot of other things that are happening around the world that may explain a slight decrease in life expectancy that we are seeing in many countries around the world. And that to me is worrisome. And that's why I think this topic is important. Of course, all these advances that increase in life expectancy in the past 100 years or so, of course, are attributable to advances in public health, primary care, therapeutics, technology, and also our evidence-based approach to healthcare and practice of medicine. Needless to say that these advances are surrounded by challenges, and here's a listing of those challenges: chronic disease dominance, unhealthy lifestyle behaviors, environmental issues, social factors. A case in point is inequities, on which there's been a tremendous amount of discussion worldwide. The cost of care, regulations, medical errors that are made in healthcare institutions that are responsible for many deaths, the crisis risk, the pandemic, we saw one not too long ago, 2019, we are still grappling with it. Drug abuse, and also the challenge of misinformation, which is also of concern to people around the world, all of which is impacting our health and well-being. Now, I want to say a couple of words about the chronic disease paradigm because that's the one that is really hitting us hard. Approximately 70 to 80% of mortality around the world is due to chronic illnesses, and examples of which include heart disease, hypertension, cancer, diabetes, strokes, and so on and so forth. But here are some characteristic features of that chronic disease paradigm that we're experiencing. One is that they cause premature mortality. People are dying earlier than they should be. They're also accompanied by chronic pain, depression, anxiety, which are widespread and are of concern to healthcare professionals around the world. Many people who suffer from these conditions are unaware that they have a problem. And I want to give you the example of diabetes. 1/3 of diabetics do not know that they suffer from diabetes. And again, that to me is troublesome. And if you look at the future, this is what the future looks like. As an example of chronic disease paradigm, here are some projections for obesity. And as you can see, the prevalence, the incidence of obesity is not stopping. And these are all high income nations. Now, if this were true, and here was a news item that appeared not too long ago in a newspaper, that if this is true, research will shows that 100% of Americans could be overweight by 2048. Now, this may be US, but I am sure if this is true. As I said earlier, you will see similar trends in other high income and middle income nations around the world. So the question that arises is, what are the factors that are contributing to these negative health outcomes in terms of chronic illnesses? Why are people dying early? And why there's so much misery, pain, and anguish? And these are some of the famous studies, and I'm sure you're all aware of them. I won't go into the details, but just to make a point that many of these conditions conducted had to deal with metabolic conditions, chronic illnesses, cardiovascular problems. And the one thing that they pointed out, then when you look at the risk factors that contribute to occurrence of many of these conditions, they include tobacco use, unhealthy diet, lack of physical activity, excessive use of alcohol, overweight, stress, and inadequate social integration and social relationships. All right, let's go further. Here is a report from the Lancet 2019. You see how these things are coming up in recent time. The Lancet wrote a great report on the burden of cancer and discuss the factors that are contributing to cancer pathology around the world. And they singled out in that smoking, followed by alcohol use and high BMI, an indication of obesity, if you will, which are of serious concern and should be prevented. We must make every effort to prevent it. So to put things in perspective, moving just beyond risk factors, here's a question that was asked at an American Integrative Health meeting in 2018 by Wayne Jonas, who was the first director of Office of Alternative Medicine at the NIH in the US. The question he asked was, where does health come from? We are talking about risk factors, but where does health come from? Can we go to the roots of what causes illness? And his discussion, he talked about the contribution of various modifiable factors that contribute to negative health outcomes. And this is what he said. He said, when you quantify, you will see that 84% of health comes from behavioral and lifestyle impacts, and also from social and economic impacts. And only about 16% of health come from medical treatments that you and I receive in outpatient situations in hospital care. So here's a distribution, 20% coming from medical and clinical factors, and 80% of health is derived from other factors that I alluded to, of which lifestyles are extremely important. Now, I want to make a point that it's hard to differentiate between lifestyles and other environmental and social factors. And again, I'll discuss those in a few minutes. Well, if that's the case, what about genes? Do genes contribute? Do genes play a role? Well, we know, this is some research, that 70 to 90% of chronic disease risks are probably due to differences in environments. things around us and all of those factors that I said. And about 10 to 30% risk is probably due to genes. And in case of obesity, as an indicator of chronic disease pathology, that the risk for obesity may be higher. But here's the punchline. The punchline about obesity, and again, as an indicator of chronic disease pathology, within quotes, about 2/3 of the risk of obesity may be genetic. But as with most other predispositions, that risk is expressed only with exposure to lifestyle factors that are controllable. You see, again, a very important point that how some modifiable factors can control even genes to a point. And I think that information is important. So moving along, putting things in perspective, how I said my first objective is to talk about the current paradigm. And if I had to summarize these thoughts, this is what the paradigm looks like. The paradigm in which we suffer from these negative outcomes, I alluded to those: cancer, diabetes, heart disease, obesity, pain, depression, dementia, and so on and so forth. If you go back in chronology and follow these individuals who experience these negative outcomes, you will see that they undergo physiological changes. And there are many, many changes, but just to give you an illustration of a couple of them, these people experience weight gain. They have ongoing stress in their lives. They experience fluctuating levels of lipids, glucose, and also changes in their gut and flora. And I think, again, going back further in time to see if these individuals are doing things that they should not be, which may be contributing to these changes, which in turn contribute to these negative outcomes that I talked about. And clearly, we now know that these individuals indulge in unhealthy lifestyles, specifically unhealthy diet, physical inactivity, smoking. They experience stress, poor sleep hygiene, and their relationships are poor. Now, all of this, of course, is not happening in a vacuum. We live in an environment, and I think that there are also contributors from the environment, and this environment has to do with social factors, physical environment, and related factors. And in fact, I was surprised looking at the WHO report not too long ago that 7 million deaths occur because of air pollution. And that's where I think environmental health becomes an important player in causation of many of these illnesses. There is the strong feeling, and again, not to go into the details, that the underlying pathology may be inflammation that could be contributing to these negative outcomes. And clearly, inflammation is clearly influenced by environmental factors, social factors, but more importantly, these negative, unhealthy lifestyle behaviors. So that's the paradigm we are dealing with. And that paradigm is the one that's responsible for many things that are happening. And sure enough, if you bring in unexpected events or other things that happen in crisis, that could even damage our health further. And a case in point is what we saw recently, which is COVID-19. COVID-19, obviously, in my opinion, as I've said, turned the world upside down. It resulted in delay in care among people with chronic illnesses, caused a lot of depression, resulted in lifestyle changes, particularly weight gain in some countries with poor resources, starvation, drug abuse, high rates of suicide, and resulting in isolation as well as loneliness. Having said that, presented a somewhat a negative thing to the paradigm, here is a note on from an optimistic standpoint. Science tells us that the chronic disease progression that I talked about can actually be stopped. You can stop it. If it occurs, you can reverse it and control it, resulting in positive health outcomes to take away misery, pain, and also reverse illnesses. And I'll share with you some data on that. And that can be done by these 6 things, which basically form the pillars of lifestyle medicine, which is how we define lifestyle medicine. So lifestyle interventions can prevent, treat and or reverse diseases and improve quality of life. And we've seen that with diabetes, we've seen that with heart disease, we've seen that with dementia and other chronic illnesses. The 6 things that are of value and importance to us in healthcare include healthful eating, increasing physical activity, developing a strategy for individuals to manage their own stress, forming and maintaining healthy relationships, improving sleep, and finally, avoiding risky substances such as tobacco and drugs. Moving along, just to share with you, and again, just a few slides on the evidence. Oftentimes, we're asked, well, what's the evidence? Well, the evidence is very strong. And I'll just share with you evidence concerning the vegetarian in the area of nutrition and Mediterranean diet. We have seen time and again, and there are plenty of references here, that people who subsist on vegetarian diets, predominantly plant-based diets, have a lower rates of chronic illnesses, have a lower rates of mortality from those illnesses, and do well. Now, there is one thing that people often talk about. This is concerning people who are vegans, pure vegans. I mean, that is a concern, but I think if people are choosing their diet, if they're choosing their vegetarian diet wisely, especially foods that are fortified, I think there are no such problems. And the vitamins that are of concern, micronutrients among vegans are B12, iron, vitamin D, and omega-3. But all these things can be overcome. Anyone doing plant-based diet will have a good life and will experience lower rates of risks that I talked about. Mediterranean diet has been studied extensively. And as you know, it's a diet that consists of whole grain, vegetables, fruits, beans, fish, poultry, seeds, nuts, and olive oil. And time and again, many studies have confirmed the benefits of Mediterranean diet insofar as metabolic, cardiovascular conditions are concerned. We think that there are mechanisms, we are not sure, but it may have to do with reduced inflammation, reducing sugar levels and BMI, and this may also be happening as a result of reduced oxidative stress. Physical activity, another component of these 6 pillars, and again, plenty of evidence that any physical activity can contribute to improved health. The one other thing that has been observed, this is a write-up from BMJ as recent as 2019, in addition to any form of activity contributing to good health, that people who have sedentary lifestyle are likely to have high risk of death. So one may be engaging in the desired value, in the desired level of physical activity. But again, if they go back and lead life of couch potatoes, i.e. spending more than 9.5, 10 hours being sedentary, the risk of disease in those individuals is much higher. So any activity is good, and also doing low levels of, I mean, practically taking away sedentary part of your life from your life completely would be nice. So anything in excess of sedentary time of 9.5 and more hours is detrimental. Managing stress is important, and this has been discussed at length. We know there's a very strong relationship between the mind and the body, such that function of one affects the other. And the evidence is very strong. And again, I would not go into the details, and here are some references, and basically to show that people who engage in relaxation therapies such as meditation, yoga, mindfulness do generally well insofar as chronic illnesses are concerned. Some of these things, what's the basis of these? We don't fully understand. However, there is this field, which is, I think, perhaps shedding some light on all of this, the field of psychoneuroimmunology, according to which our endocrine system interacts with nervous system and immunology. And all of this relationship, which is quite complex, is such that having low level of anxiety, having a positive attitude, and social connectedness will result in beneficial outcomes. On the other hand, people who are stressed out feel hopeless, that the outcome insofar as their conditions are concerned will be a negative one. Now, these are individual factors, diet, physical activity, and stress, and so on and so forth. But when you bring several of these things together, you see tremendous, tremendous benefit for patients. Here's a study that really was an eye-opener for people around the world, which basically showed, and this was Dean Ornish about over 20 years ago. And what he did was he took a group of patients suffering from heart disease. The one he gave what is here the LG group, and to them, they received whole foods, predominantly vegetarian diet. They exercised, they were doing stress management, smoking cessation, and they were receiving psychosocial support. This group was compared to a group that received the usual good care from doctors. These are patients with heart disease. And amazingly, 5 years later, people who were in this lifestyle medicine group did extremely well. This is an indication of how the coronary arteries, the lumen widen, and the complications were much lower as compared to complications that were seen in the usual care group that were receiving care from their doctors. So clear an indication that people who do lifestyle um, um, interventions do far better than people who are receiving care from their doctors. This is a study that was published in The Lancet, again, a recent study. And the question that they asked is it possible to bring about remission in diabetes? And again, without going to the details, there was a group that received special support and also a certain kind of diet. And they were compared with a control group that received care insofar as optimal care for diabetes was concerned, according to standard guidelines. And what they saw was amazing. 12 months later, diabetes remission in the lifestyle medicine group was seen in about 40% of patients, 46 to be precise. And if you follow the same group at 24 months, while the remission may have dropped, but it was still at 36%. Now, that to me, even if you have 1/3 or 40% of patients showing remission, this is a finding that we need to explore further to see if we can find ways and means to bring this care in managing our patients and helping them, and with a positive outcome of diabetes remission. A very positive finding, and I think it's good to know that these encouraging results will take us forward in controlling diabetes and perhaps bringing about remission in patients who suffer from these conditions. The question that I'm asked is, well, what's the scope of lifestyle medicine? I talked about heart disease, some evidence for diabetes, but if you look at the studies, I would say that these are the conditions where I think lifestyle medicine could be helpful to patients. To me, it's for everyone, because I talked about the preventive role of lifestyle medicine, but also people who suffer from these conditions: metabolic, CVS, diabetes, heart disease, hyperlipidemia, hypertension, stroke, and obesity, mental health, anxiety, and depression, and also plenty of evidence to suggest that many of these troublesome disorders that a community faces, in any community, it is believed that about 35 to 40% of patients who are attending outpatient clinics may suffer from one of these conditions. And I'm talking about irritable bowel syndrome, I'm talking about heartburn, I'm talking about tension headaches, fibromyalgia, chronic fatigue, atypical chest pain, and the list goes on. That such patients could benefit from lifestyle medicine approach. There's also plenty of evidence to suggest that other patients with chronic conditions such as chronic pain, musculoskeletal conditions could benefit from some of these interventions. So, the one thing that we often say that randomized controlled trials, when we conduct them, that these trials, the findings are related to populations or sample size included in the study, which means that these are experimental conditions. The benefit only goes to people included in that study in terms of age groups, gender, and so on and so forth. what is there to say that the findings that you see in randomized controlled trials will apply to the world as a whole? Well, obviously, that's one of the limitations of randomized controlled trials. With lifestyle medicine, there has been, I think, at least a couple of studies, and I want to talk about blue zones. You've heard of blue zones, where we are seeing benefits in the real world. I want to talk about that. And therefore I always make a distinction between efficacy, which is the benefit that you see in RCTs, as compared to benefit that you may see in real world situations. And that Blue Zone project offers some insight in terms of how people may benefit from these things who live in situations that have built-in healthy lifestyles in those communities. So this should take no more than 3 or 4 minutes. It's the story. Some of you who heard me before may have seen the story that I've shared with you, but I think it's important perhaps to mention it again, because I think it lays very important foundation in terms of building the context for bringing lifestyle medicine into a healthcare system. This is a story concerning a gentleman named Moraitis, who came from Icaria in Greece, moved to the US. And there's a whole, so I won't read all this, got married, bought a car, and so on and so forth. One day in this is earlier his days in the US, climbing stairs was a chore for him. He had to quit working. He gave up work, went to the doctors, underwent testing, and apparently was told by 9 different doctors that he suffered from lung cancer. As he recalls, that they gave him about 9 months to live, and he said, well, that's how long you have. So Moraitis decided to return to Icaria, Greece, which is where he had come from, and wanted to be buried with his ancestors, of course. And he decided to go back, and thinking that he would die in 9 months, and he wants to be buried there. Now, this story is really fascinating, because this is a man in his mid-60s, and this is who he is at age 100 plus. What happened? And for him to have lived for 30, 40 years was tremendous. And obviously the questions are asked. This was a reporter who has become quite famous, Buettner. You may have heard of Dan Buettner. He's the one who wrote the story in New York Times. So he asked Moraitis, how does he think he recovered from lung cancer? And Moraitis said it just went away. I actually went back to America about 25 years after moving here to see if the doctors could explain it to me. And Buettner asked, and what did the doctors say? And this was his response. He said, my doctors were all dead, Moraitis said. Now, I think it's an interesting story because it raises questions. It raises questions about people such as Moraitis, who came from Icaria in Greece. And if you go back and look at these communities, these people live to be 100 plus. Many of them are centenarians. So obviously, Buettner, that became his project. He wanted to see where around the world are people living longer, 100 plus, where there are high concentrations of centenarians. And his research has led to some very fascinating findings. And here are those 5 places where people live to be 100 plus. Clearly in Loma Linda in California, in Costa Rica, Sardinia in Italy, Icaria in Greece, which is where Moraitis came from, and also Okinawa in Japan. And so the question, of course, he asked was, what is so special about these communities? And again, no different from what I said earlier in terms of lifestyle habits. The lifestyle habits that they engage in are very healthy. So here is one, and of course, it has to do with basically physical activity, that they move naturally. They live in communities where they're nudged into movement every now and then. And that's their default way of living. It's not as though they have to go to gym every day for an hour and so on and so forth. This is their normal routine life. And that was one. The second thing is, of course, they basically dependent on plant-based foods. I talked about that, and there's value to that. And then there were additional 3 or 4 features that were common to these communities. One is they belong to a faith-based organization. They adopted routines that shed stress. They have close relationships. I talked about that earlier. And they have purpose in life. This was fascinating. They have purpose in life. And apparently, it's a quote from one of the journals: having a sense of purpose in life is worth up to 7 years of extra life, which adds to your life expectancy. Fascinating. Now, based on what I presented to you and based on what I've been reading recently, there is a strong feeling that we need to go beyond the 6 competencies that I talked about. And perhaps we may include another 2 or 3 competencies to broaden, to expand the lifestyle medicine framework, to provide more benefits to communities and patients that we see. And these competencies, again, I will just mention them. We think should include processed foods, including excessive consumption of sugars, which are causing serious problems, and oral disease around the world. Environmental exposures, I explained earlier that 7 million deaths are occurring due to air pollution. Should we not be including air pollution in the care we provide to patients insofar as air pollution is concerned, staying away or perhaps wearing other masks and so on and so forth when warranted? And the fourth thing, of course, is the social determinants of health, which are extremely important. So I think expanding that would be helpful, hopefully provide additional support to our patients that we see and also the community. So this is the final objective, and I'll be very brief in terms of developing a strategy. Of course, one could talk about hours on this, but here are some of the thoughts that I have for all of us, for healthcare practitioners, in terms of having a strategy in which we build lifestyle medicine as an important component of healthcare. And such a strategy, insofar as lifestyle medicine is concerned, should be guided by evidence, by science, and community needs. I feel it should become an integral part of healthcare. And I think to that extent, we should engage in providing education, provide skills and knowledge to healthcare practitioners. I was never exposed to any of this when I went to med school. And many of us have not been exposed. So I think it's time to try and incorporate this in education program. I personally believe that there should be a 101 on lifestyle medicine for all healthcare professionals across the board, not just the doctors, nurses, all allied healthcare professionals should receive 101 insofar as lifestyle medicine education is concerned. Needless to say that some might benefit from specialized lifestyle medicine care. I think we should go out into the community, talk to adults, talk to school children. And while doing all of that, fighting this thing in misinformation, it's very troubling. And we've seen that with COVID-19, how misinformation spread and had caused disagreements, put doubts in minds of people. And I remember how when we were hit by COVID-19, there was, even during the first 3-4 months, there was disagreement between the US Center for Disease Control and WHO, whether or not people should be wearing a mask or not. I mean, we can't do that. And I think misinformation must go away, and we must make every effort to fight that. Developing clinical practice guidelines is extremely important because we're still, earlier in this. I think it's time for us to develop principles and guidelines for practitioners who want to incorporate lifestyle medicine in their practice. And in doing that, we must rely on patient-centered approach. One size fits all does not work for all patients. We know that. That's true, in fact, for almost any clinical discipline. We must establish therapeutic alliance with patients. Empathy and compassion should be important parts of our LM practice. Also, the third thing is that we must, it's been said that doctors or nurses or other healthcare professionals basically treat and manage only things that they can measure. Well, if that's the case, then it's time for us to start measuring sleep, activity, diet, and I think, and incorporate them into our vitals. Here is one other thing, that these things changes as a result of receiving lifestyle interventions does not happen overnight. Every patient has to meet a certain threshold. We need patience. And this is an indication. This graph shows that people who adhere in terms of the score to lifestyle medicine interventions are likely to see good results. And therefore, I think achieving a certain threshold in terms of frequency of visits, the the kinds of interventions we provide, and also involving patient involvement are all important. And the more people and patients adhere to these recommendations, they're likely to do better. This is a write-up from Washington Post that appeared a month ago. And um, this was great. It says our health isn't determined by one or two moments. It is determined by innumerable micro decisions each of us make every day. And the writer gave two fantastic examples. Consider these as mini stories. So, bacon at breakfast may be another inconsequential food in your week, while a lifetime of eating processed meats can tip the scales between colon cancer and health. And I think it's said nicely. The second quote from the newspaper is, one patient of mine agreed to adopt his relative's dog 3 years ago, mainly because he felt lonely and wanted companionship. Despite being a self-described couch potato, he has since been easily hitting the recommended physical activity guidelines every week because he started taking his dog for runs around the neighborhood. In addition to the mental health benefits, he's no longer pre-diabetic. Whether it's COVID-19, lifestyle medicine, or perhaps issue, fighting misinformation is extremely important for all of us. And I would encourage you to get involved in this. Any opportunity to educate community in terms of fighting misinformation should be at the forefront. And in doing, listening to the fears of people, empathizing with them, reducing cognitive burden, speak to them in the language that they understand instead of saying 10%. It's probably helpful to say 10 out of 100, whatever the case might be. Point them to credible sources. Do not publicly shame anyone, whether it's a patient or community. Includes all a decent, persuasive language. As I said earlier, empathize with them. And in doing all of this, it's extremely important to rely on science and evidence. And as this quote says, if we don't, then we turn pain into suffering by adding on all kinds of beliefs, interpretations, and judgments that go with it. So, what I've said in the past 30, 35 minutes is I'm not saying it's one system, the other. I'm not saying that it's only lifestyle medicine. I think our healthcare is about one composite, wholesome system in which it is about evidence-guided approaches or interventions in which conventional modern care, lifestyle medicine, as well as complementary approaches and self-care complement each other. And to me, I think such an approach, call it whatever you want to, integrative, composite, wholesome, that's the one. It should be guided by science and evidence, and basically that's the way we should move forward. Needless to say that, we all people go through issues in life. We will have issues. To me, giving up is not an option. And I think this encouraging little quote from Trent Shelton says it all. We're all a little broken, but last time I checked, broken crayons still color. And to me, I think lifestyle medicine, as part of this wholesome approach, offers hope, optimism, and inspiration. So this is my last slide, and I want to thank you for listening to me. And I'll be glad to take any questions and comments that there might be. Thank you so much.
Thank you, Dr. Mamtani, for that enlightening talk. Indeed, with all the evidence which is available now, it appears that lifestyle medicine is indeed that breath of fresh air that we need in our healthcare.